With Oracle EPM Planning, you can perform flexible and data-driven planning and forecasting required by your healthcare organization. The Oracle Healthcare Planning Solution is a highly configurable implementation accelerator developed on top of Oracle EPM Planning Financials, providing best practices for healthcare to facilitate your planning process. The role-based navigation flows were designed with the end user in mind and follows best practices for a standard healthcare operational planning and forecasting flow. Provider finance includes all tasks in Nurse Manager and Department Manager. The vertical tabs on the left represent a process flow for your budgeting process. Each main section opens an overview dashboard that allows you to view and analyze data at a higher level. The out-of-the-box visuals are based on KPIs and can be tailored to your organization's needs. Let's review both fixed and variable non-staffing expenses. We can plan by account for a single cost center, or plan for one account across multiple cost centers, allowing you multiple ways to approach your planning process. Variable expense drivers are defined in global assumptions. Expenses are calculated based on variable or fixed percentages. For expenses, a rate called a dollar per unit of service is calculated from the volume number and the expense driver. When planning your projections, for both variable and fixed, you select a forecast method. Then, plan for your variable expenses. You can select to enter a % of increase. This calculates the baseline dollar per unit of service. Then you can enter your adjustments, whether to increase or decrease your dollar per unit of service to get to a total which derives the projected run rate for the remainder of the year. This becomes your volume rate. The variable total is then calculated from the volume rate and the volume total, leveraging that dollar per unit of service. For fixed expenses, with the forecast method selected, you can enter a % of increase. The fixed expense is then calculated based on your selections. You can then make unit adjustments here. The fixed total is then displayed here. Total plan then displays the values derived from both fixed and variable totals. After creating your projections, you can repeat the same steps to complete your budget. Review staffing expense data on its overview dashboard. Salary expense by department is also a dashboard where you can review more detail, including drivers used in the calculation. You can plan staffing expenses using two staffing models, variable and fixed. For variable staffing, plan by cost center and select a job code. View data values on the form and graphical representations of your data on the right. You can project and plan for productive hours and get quick answers from calculated breakdowns of regular hours, overtime, and other scheduled work. Adjust the wage rate by dollar or percentage, and that will calculate the appropriate wages when data is saved. Calculate the number of required full-time employees or FTEs based on the volume and rate, and see a breakdown of how the hours are distributed for the FTEs. For fixed staffing, since you don't need volume assumptions, you can plan for FTEs and their wage rates. While fixed employees typically do not qualify for overtime, a provision for overtime is included for exceptions. For example, you might have a non-exempt employee who is categorized as fixed, such as a nursing supervisor, because they need to be staffed to a minimum level or are required to be on the floor but are technically variable staff. Related videos are listed in the description. To learn more, visit docs.oracle.com.